Are you struggling with the RCA? Maybe you feel that you don't have the confidence to pass this exam. This is a common problem that I've observed registrars encounter. This confidence issue holds them back. Today I'd like to share with you a one-on-one coaching session with a GP registrar called Dr. Phil, who actually had issues with confidence, and she really struggled with her confidence to the point that she didn't actually book her test and had to delay her test. In this conversation, you're going to learn what are the things that we talk about to help boost her confidence back. And Hannah eventually passed the RCA on her first attempt with a score of 182. I hope you learned something out of this coaching session.
I think the interpersonal skill, you've got it. The listening skill, that's fine. It's more the confidence that's a big problem from previously with coach you. And the main thing here is that preparation is key, I think. If you prepare well, then you're more likely to do it well. The other thing is sometimes what I've observed is that you might doubt yourself. So if you look at the case, you probably know what's going on, but then when you're doing the case, then you kind of second guess yourself, and then it can mess things up. So if you're finding yourself not too sure, then go with your gut feeling, what you thought initially, and what makes most sense to you, because it's very important not to overthink it, because if you try to overthink it, that's where you're likely to go in a wrong direction for the consultation. So as long as you're doing it safely and you're thinking logically, I think that's fine. Like, justify if you need to justify why you're doing so, and then this will give you more confidence. And also the examiner knows what's going on. But I think the confidence is something that you get more of it by showing to yourself that you're managing to do it. So if you look at when you first did some recording and how far you've come, if you look back, then you'll be able to say to yourself, I've got what it takes, and I'm making progress. So focus more on the progress that you're making rather than on the outcome. So you can only control what you can control. If a patient decides to talk a lot and you're using your interpersonal skill to interrupt them a couple of times and still going off a tangent, then there's not much you can do about it. You can learn from the circumstance and just move on. Don't waste your time trying to record it and trying to beat yourself up, because there's another patient you'll be able to consult, and some of the patients, they're just not suitable for the RCA, so don't worry about them. I know that you said that you're getting it to 14 to 15 minutes. Try to see whether you could do it in 10 minutes, just as a challenge, because if you can do it as 10 minutes, then you'll find that you're more sharp in asking the questions that's going to drive the consultation forward. If you know that you have 12 minutes, then you're more likely to dwell, and also the question that you're asking might not be as sharp, so you're going in circles sometimes. So that's why I would say try to do it for 10 minutes, see how your mind is working with that, and then you will find that if you kind of put this constraint on you, doing it 10 minutes, then doing it 12 minutes will be easier. So try to do it that way, I'd say, so that you can manage your time. To have shared understanding with your patient, both of you are on the same page. So if a patient come in and think that they might have appendicitis from this pain in the right upper quadrant, and you're taking that history, you think it's more likely to be gallstone, then you need to actually verbalize what you think and why you think that's the case, and then tell the patient by bringing what their thought was. They thought was appendicitis, then to reassure them why you don't think it is that, but why you think is more likely to be gallstone. So once you've got the shared understanding, you've made a working diagnosis. The next step is to actually discuss what we can do about this. So what would you do about this? So you could actually manage it. There's lifestyle modification they can do in terms of the diet. You bring back what they say to you about how they're managing the pain. What else you could do? You could refer them for an ultrasound scan. You may be able to refer if its pain is still not under control, to the surgery. Think about next step. Next step, you want to make sure that the patient understands that plan. Was there anything that they were hoping when they came in? They were hoping maybe to get some medication, then tell them what you can prescribe them. Are they happy with that? Next step is to make sure that the plan that you've got, they actually are happy with that and that meets the expectation. If it doesn't, then offer them an alternative. So once you've done that, then the next step would be to discuss about the follow-up and the safety netting, and then that's a close. So if you follow through these steps, then it will come quite naturally to you if you have these steps clear in your mind. Clinical management is where it's more exciting because you're making a change to your patient. So instead of having this anxiety, use it as a thrill that you're going to make a change and impact this patient. And because you're nearly approaching your end of training and you've got so much experience, you have done it so many times, so you'll be good at it. It's just a matter of demonstrating that you're able to do it. And there will be some days where you find that you're struggling, but most of the time what happens is that by improving your skill, you will eventually get the cases where you're managing it very well and you're safe and you're doing it within the 12 minutes. So focus more on improving your skills and iterating and reiterating from looking back. So when you're reviewing your cases, look at what you're doing and what things that you might change next time. And then you'll find that you get better instead of finding that you're sticking and doing the same mistake. So write down things, take note, review and reiterate things. That's how I do it. Getting feedback from other people as well, from my educational supervisor.
If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you'll get some insights. I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestion. Take care everybody. Bye bye.